is Dr. Madan, Assistant Professor in the Department of General Surgery, and I have 8 publications to my name and many other papers. So today we are going to be discussing about tuberculosis and its implications. So what is tuberculosis? Tuberculosis is an infection which is chronic granuloma producing one caused by Mycobacterium tuberculosis complex. So why should we know about this? A lot of patients suffer from tuberculosis and a lot of disability and deaths occur due to tuberculosis, and especially in the developing countries. So today we will be learning a lot about it. So what is tuberculosis? It is an infection caused by Mycobacterium tuberculosis and its agents. So how does it produce? It's two types, primary and secondary. Primary is more on the lungs, secondary other than the lungs. So how does it come into our body? It is mostly due to airborne droplets from another infected person. So when you inhale, these Mycobacterium tuberculosis gets lodged in your lungs, and where your alveolar macrophages act on it and they engulf it, and this tuberculosis bacilli, they multiply in your macrophages to produce granuloma, and this granuloma together they form caseating necrosis. So what predisposes to this infection? It is HIV, immunosuppression and diabetes and malnutrition. So let's look into primary tuberculosis. So what is the site? It is lungs, predominantly the upper part of the lungs, upper lobe. So what type of lesions do they produce? It is called as a gone focus, which is caseating necrosis along with the regional lymph node. It's called as a gone complex. So how does it heal? What is the fate of this gone complex granuloma? It heals with fibrosis, and when it undergoes reactivation due to immunosuppression, you have secondary TB. So what is the secondary TB? So anywhere from the primary, when this tuberculosis spreads to any other part of your body, this is called as your secondary TB. So how does it go? It can go via your lymphatic system, it can go via your hematogenous spread or via direct spread. How this direct spread occurs? When you have the sputum and this sputum is swallowed, this goes to your stomach and it reaches your Peyer's patches in your intestine, and the multiplication of the tuberculosis happens because tuberculosis has more affinity towards the lymphoid follicles. So the same mechanism what happens in the lungs occurs here too. The lymphocytes engulf the tuberculi and there is a multiplication, and this leads to various complications in the abdomen. So secondary tuberculosis, it is a reactivation of latent foci or reinfection, and lesions it produces is caseating granulomas and fibrosis. So what are all the pathological features? In pathology, we will have the caseous necrosis, which is the hallmark, which contains Langerhans giant cells. So cavity formation, this occurs mostly in the lungs, where this discharge of the caseous material occurs into the surrounding regions. So when it heals, you have fibrosis, which can lead to bronchiectasis. So what are all the clinical features of tuberculosis? So clinical features as such for the primary and the secondary is different. So when it occurs in the lungs, you will have chronic cough, which is cough for more than 2 weeks, and evening rise of temperature, and you will also have loss of appetite and loss of weight. So when it comes to the abdomen, there are a lot of presentations. You will have loss of weight predominantly and abdominal pain, which can be a chronic in nature for more than 1 year. And patient can also have diarrhea or constipation. So respiratory symptoms, patient can have cough, hemoptysis, chest pain and dyspnea. So what are all the common sites for the secondary? Secondary is mostly to the lymph nodes, your cervical lymph nodes, to the abdomen and skeletal spine, port spine we call it as, and it can also go to your hips and knees, and the genitourinary system, especially the kidneys are very much affected because of this, and even your testis, epididymis can also be affected. When this goes to your CNS, it causes meningitis and tuberculoma in your brain. So what are all the investigations that we have to do? So for any tuberculosis, the most important thing for you is to demonstrate that the tuberculosis is present there. So how will you demonstrate that? You can do a staining. This is called as a Zeal-Neelsen staining or the AFB, which demonstrates the acid-fast bacilli. So how can you grow it? You can grow it in a Lowenstein Jensen medium, but it takes up to 2 weeks for you to have the culture to show that the presence of bacilli is there. So we have modern techniques to demonstrate, because we cannot wait that long to diagnose a patient with TB. So the modern ones are the Gene Expert and the CBNAT. So these help in detecting the tubercular nucleic acid in the sputum as such. So CBNAT is cartridge-based nucleic acid amplification technique, where we amplify the nucleic acid of the tubercular bacilli. So with imaging, you can go for chest X-ray and CT, which can demonstrate the fibrosis. And Mantow, it is just a hypersensitivity reaction. This just predicts that you might be suffering from tuberculosis, but it is not a definitive investigation. So how do you manage any tuberculosis? The treatment is only anti-tubercular drugs. So what are these anti-tubercular drugs? This is previously it was called as DOTS. Now under the RNTCP you have intensive phase for 2 months and continuous phase for 4 months. So what are the drugs that we give in the intensive phase? It is called as HIZE. H for isoniazid, R for rifampicin, Z for ethambutol, and E for ethambutol, and Z for streptomycin. So this continuous phase is for 4 to 4 months depending upon the site of the tuberculosis. For pulmonary usually it is 4 months and you give isoniazid and rifampicin. So why is this important? Because of this drug resistance that we have, this rifampicin resistance is predominant in tuberculosis, so we call that as a multi-drug resistant tuberculosis. So where do you use surgery? Surgery is if you have any complications of the tuberculosis in the abdomen, say patient is having a perforated ulcer or patient is having obstruction, or when there is a spinal decompression due to port spine, all these areas you will have to go for a surgical intervention. So what are the new guidelines that we have for TB? Now a shorter regimen is present for drug susceptible TB. For adolescents and adults with pulmonary tuberculosis, we have 4 months regimens of HRZE and 2 months regimens of isoniazid and rifampicin. So for children, we have approximately from the ages of 3 months to 16 years with no severe tuberculosis, we have a shorter duration of treatment. So for adults for more than 14 years with rifampicin drug resistant, which is the multi-drug resistant TB, we have the WHO guideline which recommends 6 months of all oral regimens in eligible patients. So what are the other regimens that we have? One regimen is bedaquiline or pretomanid, linezolid, moxifloxacin, also known as B-PALM. The other regimen that we use is the bedaquiline, delamanid, linezolid, levofloxacin, and clofazimine, which is BDLLFXC. This is for resistive cases. So what are the complications that occur because of tuberculosis? For the lungs, you have pulmonary fibrosis and bronchiectasis, along with sometimes you can have a bullae formation, which can rupture to form pneumothorax, and secondary amyloid deposition. So that brings us to the summary. So why TB is important? TB has major implications on the health, especially in the developing countries, and TB is also a major health issue for any individual who lives in the lower socioeconomic status. So what happens because of this TB? When the primary TB does not heal, it leads to secondary TB. And when secondary TB occurs, it may not be confined only to the lungs, it can also go to other systems such as your CNS, abdomen, and any other parts in the body. So how do you prevent this? You have preventive measures, meaning you stay away from the patient who are infected with TB and you take proper mask precautions. And early diagnosis and ATT treatment is of prime importance in treating a tuberculosis. Thank you.